Okay, good. Can you call me back? And we're sure these are all the same lot, eh?
Yeah, they're all from the same box.
Okay. Dr. Kettner, what do you say to those people who suggest that the flu shot isn't safe? Or the H1 vaccine isn't safe?
Well, I mean, I'll give you a general answer, but in a real conversation like that, I'd ask them what they mean by that and what their concerns are, so I could actually speak more specifically to what they're worried about.
I think they're suggesting that it may not be tested appropriately, or the way that it hasn't gone through the normal testing that a vaccine would go through.
Well, the answer to that, first of all, is that there has been quite a bit of testing of this vaccine. Of course, the vaccine had to be produced in a hurry if it was going to be ready for this pandemic flu season. When I say in a hurry, I think people need to understand that, first of all, we've had flu vaccines every year for years now. And that part of the manufacturing process for this vaccine is the same, which is how you get the virus out of the growing in the eggs and then gathering up enough virus, preserving it, and all of those things are the same steps as has been true for a long time. What's new with this vaccine is an adjuvant that's been added to the vaccine to boost the immune response, so that you would have to use less of the virus to make the vaccine and to get a better response. Now, there has been previous manufacture and use of this adjuvant in other vaccines, so there has been some experience with it. It's relatively new in terms of this particular H1N1 vaccine with the adjuvant. So, of course, there's been testing of that this year, but couldn't have done any testing on it until we actually got the virus identified in April. And so between that day and now has been very, I use the word hurried, and it is hurried in one way, that there's been a very fast process to get this vaccine developed so we could use it in time. And of course, there are many things that have been tested just in the usual way, and then some other parts of the process have been compressed in time so that the reviews and other data have had to happen in a much more concentrated and fast way. But the Public Health Agency of Canada, the Health Canada regulator, our pandemic vaccine task group, who have all had access to the data and information, are feeling quite confident that the vaccine is safe enough to use and should do quite a lot of good and should reduce our risks for pandemic influenza quite significantly if we take the vaccine. With any vaccine, there's always potential risks, there's always potential side effects that people need to understand. And we're doing our best to describe that, share that information with people so they can make their choice. But I'm going to say that especially for people at higher risk of severe disease for this pandemic virus, that potential benefit should far outweigh the potential risks of getting the vaccine.
Thank you. You need to make sure that people are protected. One way, the best way at this time is to get a vaccination, and so I'm here to demonstrate that it is safe. I believe it is safe. We have to trust that their good judgment, their work on what they're telling us is good for us. And if they feel that the vaccine is safe and it will help fight the virus, then at this time, what option do we have other than not to take the vaccination? And so I think for us, I think it's better that we take the advice of the experts. We've made arrangements to get flow kits as well, made sure that we had enough of them to provide focus to those organizations that are looking after our people. The only concern I would have is people that are refusing to be vaccinated. I think people should take the opportunity that's here, given some of the challenges that we see down south in the States, where people are lining up and that they're not able to get vaccinated. Here in at least for our people, I can say that the vaccine's there and they should take advantage of that. We're encouraging our people, of course, to get vaccinated. I'm here, as a Grand Chief to hopefully lead the way. that they should do that, because if we're going to encourage them, then I should make sure that I get vaccinated as well. Take the
Pat your arm like a wet noodle.
Look here. Look at that. Don't even look over there. Look, you're on. Look over there.
It's over already.
It's over.
I am a chicken. I admit it.
Over.
That was not too bad.
That was not
Even
too
yell
bad.
wrong.
Right?
You
Let me
okay?
check on you.
I know. I
She's very good.
didn't feel anything.
No, I didn't feel anything either. I was distracted.
Oh, that goes out. Okay. I'm sorry, my hands are cold. It is a little bit. I think that yeah, you just want to have it relaxed. That's... You're not very big.
It's always very embarrassing, I guess.
I'm taking this to protect myself. I'm taking it so that there's less probability of me passing the virus on to other people, especially patients that I might look after, but also anybody in my family or at my workplace. And I'm also taking it so that I reduce the probability that I'm going to need medical care and intensive care, so that there's room for others to get medical care and hospital care when they need it for whatever reason, whether it's the flu or other more common reasons that people need to go to the doctor and get hospital care. Another reason is I want to reduce the probability that I'll be sick and have to miss work, because like everybody else, I have a job that's important, and I don't want to have to miss work unnecessarily, especially in the next 8 weeks. And
as a visible person in the community, was the symbolism of getting it also important?
I was just getting to that. So the last thing was to demonstrate my confidence that the benefit from this vaccine that I'm expecting will outweigh the risks that any vaccine is associated with.
You're not concerned?
Oh, concern always. Always very much concerned. Take every medicine or vaccine seriously that I decide to get. So concern I have no problem with. Am I worried? I'm not worried. How are you doing, Kat? You need any moral support?
Yeah, so please.
No biggie, loose like a cooked spaghetti noodle. Do you like spaghetti? Make it all loosey-goosey, and then it'll be done in like 3 seconds, okay?
Okay, there's going to be a bit of a poop.
It's probably better if you don't look.
Let's look at everybody over here. Look at all these people. Look at them.
We're almost done. You're being so good. Oh my goodness.
Awesome. Is that all done?
It's done, and it just
Look at that. Did you give a big smile for everyone?
You did awesome. How about a high five?
No.
No? But you know what else you